this evening for this most important information session on COVID-19 vaccine. You know, this pandemic has touched the communities of color in an unprecedented way and in unprecedented numbers. So, in an effort for us to continue to raise awareness about the vaccine and its importance, we have assembled a team of experts to make a brief presentation and to answer any of your questions. So, tonight, if you have any questions, this is the time to ask them. But before we jump into the presentation, I would like to take this wonderful opportunity to introduce the North Atlantic Regional Director for Alpha Kappa Alpha and the Executive Director for the Sickle Cell Association of New Jersey, Mary Bentley Lamar. After Mary Bentley Lamar speaks, we will then be joined by our moderator, Dr. Corda Decoto of Essex County Director, Maya Lordo, and our special guest, Dr. Adrian Phillips. So without further ado, Madam Regional Director, Mary Bentley Lamar, you have the floor.
Thank you. Thank you. Good evening, everyone. And I too want to thank you for joining in this evening because this is such an important topic and it is a matter of life or death. As the founder and executive director of the Sickle Cell Association of New Jersey, I'm very well aware of the disparities that affect our people because I deal with a population that does have serious chronic health challenges. So anyone with any health condition, or even if you're African American or minority or overweight, any number of reasons that can affect how COVID can adversely affect us. So we are here to learn, and as the director of the North Atlantic, which spans from Washington, D.C. to Maine, but I am so proud that I am a member of this Omicron Psi Omega chapter in Montclair. This is my chapter, and I applaud you for putting on this program. And I want to thank in advance the county commissioner, health commissioner. Did I get your title right? I hope so. I didn't.
I'm the health director and health officer. Thank you, though.
Got it. I gave you a promotion.
You did.
And also Dr. Phillips and Dr. Decoto, who is on, so to share your expertise. And as you know, we are very much behind encouraging individuals to know more, get the vaccine, and help themselves and the community. So this is just one more effort and one more initiative in that effort. And I thank you for doing that. So I'll turn it back to you, Madam Chair.
All right, thank you so much for those remarks, and thank you so much for joining us this evening. And I am going to turn it over to Dr. Corda Decoto to introduce our speaker for the evening.
Thank you so much, Madam President. Thank you so much, Madam Regional Director. Good evening. My name is Dr. Corda Decoto, board certified podiatrist of the Heart Center of the Oranges, and it is my pleasure to be the moderator for tonight's wonderful discussion. We're going to talk about COVID in all forms or fashions. Your questions you can put in our chat because we want to know what you're thinking, and hopefully we'll be able to answer all your questions. So without further ado, let me introduce my colleague. Dr. Adrian Phillips is a third-generation physician who followed in her family's footsteps to provide compassionate and comprehensive care for patients with cancer, particularly those with aggressive blood cancers and those who require bone marrow and stem transplantation. She received her undergraduate BA and medical degree with honors from Brown University. She received her MPH from Harvard University. She then received her internal medicine training at the New York Presbyterian Columbia University Medical Center, where she also completed her fellowship in hematology and oncology. At Weill Cornell Medical in New York City, Dr. Phillips specializes in treating patients with HTLV-related adult T-cell leukemia lymphoma, also known as ATLL, through stem cell transplantation. She works together with a multidisciplinary group to bring the most state-of-the-art and life-saving transplant options to people with blood disorders and cancers, including leukemia, lymphoma, and myeloma. She treats her patients as individuals and is there for them every step of the way. Without further ado, please help me welcome Dr. Adrienne Phillips. Welcome, Dr. Phillips.
Thank you so much. Can you hear me?
I can hear you.
Oh, fantastic. Good evening, everyone, and thank you for that introduction. It's really a pleasure and my honor to be participating in the program tonight. And though I'm coming to you from my office in New York City on the Upper East Side at Weill Cornell, I was born and raised in Essex County, and I definitely still consider myself a Jersey girl. So I prepared some slides, but before I got into them, I thought I would take a moment just to reflect on my own personal experience with COVID over the last year. So when COVID hit New York City last spring around this time, our hospital was really hit hard. As a cancer specialist specifically, this impacted me because many of our hospital's elective cancer procedures, for example, screening mammograms, colonoscopies, were shut down. A number of patients getting chemotherapy had their regimens and schedules altered to minimize their risk for contracting COVID. Elective surgeries were delayed because many of our operating rooms were converted into intensive care units to manage all the COVID patients that were on ventilators. And I myself was pulled to cover one of our many inpatient COVID units because it was a truly all hands on deck situation. And at that time, really the end of March, April, early May, everyone coming into the hospital had COVID. I had never seen anything like it, whether you were coming in for symptomatic COVID, coming in for something else and incidentally tested COVID positive. We were just packed with COVID patients. And unfortunately, I lost a number of my cancer survivors to COVID. And I definitely also had colleagues impacted. And it was a horrific experience. And what was particularly challenging about it was that these patients were alone. When you were admitted to the hospital, you were put into isolation. You were getting sick and you couldn't have your family members come visit you during your greatest time of need. And it was a really horrific, like I said, experience. But fast forward through the summer, fall, and winter months, though COVID remained an issue, we were getting better at treating it. Our caseload dropped. We were developing effective therapies. And I heard about the vaccines, and I couldn't believe that, they were approved in less than a year. And this was fantastic. And as frontline workers here at the hospital, we got emails saying we'd be eligible to get vaccinated early in mid-December. And I was so excited. After everything I had seen, I just couldn't wait to be among the first to get vaccinated. And can you believe the week before my COVID vaccination, I tested positive for COVID? I haven't shared that with too many people, but I had mild symptoms myself. I had a sore throat, a dry cough, some muscle aches. And I probably would have thought I just had a cold, but obviously because of the pandemic, I was concerned and had good access to testing and rapid testing. And I was actually surprised when I tested positive. But unfortunately, shortly after I tested positive, I realized I had to go back and contact trace. And I had exposed some of the members of my family who are dearest to me, including my elderly parents who live there in Essex County. And although they were feeling okay, I urged them to immediately get tested because I know they had been exposed. And my dad, who's 80 years old with multiple medical problems, also tested positive. And initially he felt fine, but really within 24 hours, he deteriorated. He became weak. He developed a dry cough. I had gotten them an oxygen monitor for them to be checking periodically. His oxygen levels dropped. And everything that I had been through just kind of flashed in front of me. And I really panicked and had to do everything I could to help both of us get better. And fortunately, we had clinical trials available at that time here at New York Presbyterian. And we had a specific clinical trial available for a monoclonal antibody treatment. And you may recall in the fall, there were some prominent politicians who were touting a an antibody treatment as a miracle drug. It hadn't yet been approved, but it seemed that they got this therapy and they had a dramatic recovery. And we had clinical trials for that same treatment here in New York at Cornell. So to make a long story short, my father and I both qualified for that study. We got treatment, and I honestly have to say, I've never seen anything in medicine work so quickly. We quickly turned the corner, our symptoms got better, and now fast forward about 4 months, we're both feeling 100% and doing well. And because of that treatment, we had to wait 3 months to get our own vaccines. But I can now say I got my second Pfizer vaccine last week. I'm feeling great. And my parents are also mid-course in their vaccines. So that's my personal story. And for this reason, I'm really excited to be speaking tonight about COVID-19 and ways that we can prevent it. Next slide. Sorry, was the slide advanced? I'm not seeing it. It's there?
It was.
Okay, sorry about that. My computer just acted a little funky. Okay, so what is COVID-19? So COVID-19 is a disease most commonly associated with pneumonia, and it's caused by a virus called the SARS-CoV-2 virus. And this virus is spread through either droplet transmission or airborne transmission. And droplets are developed when you cough or when you spit, and the saliva kind of falls immediately in front of you, falls on surfaces, maybe lingers around. But we also know that airborne transmission of tiny particles can cause transmission at even greater distances. Next slide. So COVID-19 can cause serious life-threatening complications, and we know that as of March of 2021, there have been over 1.8 million people hospitalized and over 530,000 deaths. But COVID illness, go back one slide. Thanks. But patients newly presenting with COVID-19 can have a variety of symptoms, and it's hard to predict who is going to become symptomatic with mild disease, who's going to be severely symptomatic. And as you can see, the symptoms listed here range from not just respiratory symptoms, but also diarrhea, loss of taste and smell, headaches. Next slide. And we also are appreciating that people can have longer duration of symptoms or complications from COVID-19. And we're still learning and describing this, but there's certainly reports of COVID impacting the heart, impacting the kidney, people impacting the nervous system, people complaining of brain fog. People with COVID might be predisposed to develop blood clots. And we're also now realizing people can be reinfected. And there have been several case reports of patients here in the United States and abroad, patients who've been reinfected with the virus. And some of these patients have very mild symptoms, but some have more severe symptoms. Next slide. So why should you get vaccinated? So vaccines are a very powerful and effective tool to fight COVID, both for you individually, but also for your family and your community, and particularly for your family and community members that are at higher risk of complication from COVID because they are elderly or they have other chronic medical problems. And this was just my instance, infecting my father despite all the precautions I was taking interacting with him. Next slide. And we can learn from history that vaccines have been very effective in reducing a number of pandemics and diseases. And this table just highlights some of the many diseases that were, big concerns in the 20th century. And we can see now in the 21st century, in 2019, there have been no cases of smallpox, no cases of polio, and many of the other conditions have seen dramatically decreased rates. And again, this is because of vaccination. Next slide. So how do vaccines work? So this is a little oversimplified, but it proves the point. Vaccines work by showing your immune system essentially a mugshot of the coronavirus. It's not showing you the whole virus, a coronavirus. It's not infecting you with the coronavirus, but it's showing you just a piece of the coronavirus, which is a piece called the spike protein. And if you look at that diagram, it's that kind of red diamond-shaped figure that is protruding from the circle. So when vaccines present your body with this spike protein mugshot, your body takes a snapshot of it, and your immune system particularly mounts a response and makes antibodies and releases immune cells. So when you're really infected with the coronavirus, these immune cells and antibodies can attack the coronavirus, neutralize it, and prevent you from getting ill. Next slide. So there are different types of vaccines, and specifically for COVID-19, there are two platforms that have been used to develop the vaccines. So the first platform I'll talk about is the messenger RNA or mRNA platform. So messenger RNA is essentially the code or instruction manual of how you make a coronavirus. But it's not how you make the entire virus, it's how you make the spike protein. And early on in the pandemic, researchers were able to identify the genome of COVID-19 and aided us in figuring out this code for the spike protein. So what messenger RNA viruses do is purify the instruction manual to make that spike protein, and then take that and put a fatty coating around it so it's protected. And then the vaccine is inserted under your skin. And then your body, when it sees that vaccine, is able to mount an immune response, make antibodies, release immune cells. And then when you're really exposed to COVID, those immune cells will fight it off. And the two mRNA vaccines are Moderna and Pfizer. So the other platform that's been used in the COVID vaccine development is the viral vector platform. So viral vector vaccines actually use a piece of DNA, which tells your body how to, again, make the spike protein. But instead of packaging it in a fatty coating, we take a virus called the adenovirus and essentially make it so it can't cause any disease in you. And we link the DNA to this adenovirus and use the adenovirus as kind of a vehicle or a vector to introduce that instruction manual to your cells, whereby then your cells can make the spike protein and your immune system can respond by making antibodies and immune cells. So the two viral vector vaccines are the Johnson & Johnson vaccine and the AstraZeneca vaccine. So everyone wants to know which vaccine is better. And honestly, the studies have not compared these three currently available vaccines head to head, so we do not know. But here in this slide, I've just tried to summarize some of the key distinctive features. So both Pfizer and Moderna are two-shot vaccines. The Pfizer is given 3 weeks apart, the Moderna 4 weeks apart. Both have been studied in tens of thousands of patients, and both are highly effective, preventing severe symptomatic COVID disease at rates between 94 and 95%. Some other differences between them: Pfizer is the one that needs to be stored in sub-zero temperatures, so that's impacted its distribution. Moderna needs to be cold, but not nearly as cold as the Pfizer vaccine, so it's a little easier to store and supply. So those two mRNA vaccines compared to the J&J vaccine, which is a one-dose vaccine currently, but they are doing research to see if 2 doses would be effective. It's been studied in over 44,000 patients. And the efficacy, honestly, is very high, perhaps not as high as the 2 mRNA vaccines, but certainly performs very well against preventing severe COVID disease. And to put this in perspective, the annual flu shot that you get each year prevents the flu at a rate of about 40 or 50%. So these are very high and efficacious vaccines. Next slide. So to summarize, all of the vaccines are highly effective, between 80 and 95% effective in preventing symptomatic disease. And what we're hope to learn in the future is how well the vaccines prevent virus transmission. Certainly, if you get the vaccine, your likelihood of being admitted to the hospital, developing a severe pneumonia is very low, but we don't yet know how well these vaccines prevent asymptomatic transmission of the virus. And for that reason, it's still recommended that you take precautions even if you're vaccinated. So in the clinical trials, certainly there were mild side effects, but there was no significant safety concern reported in the published trials that was overly concerning and led them to initially halt the trials. And vaccines that are available, again, cannot give you COVID-19. Next slide. So what about the allergic reactions? So these were reported, if you remember, after the vaccines were approved, when there were a few rare patients who developed an allergic reaction. And it was in this post-marketing or post-approval period that, because we were continuing to monitor patients, that the government has required that we now monitor all patients who get the vaccine for 15 minutes after you get vaccinated. For patients who have an allergy history, you need to be monitored for a longer period of time. And patients who have an allergic reaction to one of the components of the vaccine, particularly one of the components in that fatty coating that the mRNA viruses use, those patients should never receive the COVID vaccine. And obviously you should discuss your allergy history with your doctor and your vaccination team. Next slide. So what about pregnancy and breastfeeding? So the clinical trials enrolled primarily healthy adults and not pregnant women, not patients with cancer like in my specialty. But we do know pregnant women, if they get COVID, have bad outcomes and they can get very sick. And it's the recommendation of the American College of Obstetrics and Gynecology that all women planning to get pregnant and who are currently pregnant, in fact, get the vaccine. And they also recommend that you can get the vaccine if you are breastfeeding. Next slide. So a concern that many people have voiced is, how was this vaccine created so quickly? Nothing has ever been approved so fast. What steps did they skip? And should we really believe the data? And the reason the vaccine was approved so quickly is because it was a huge international collaborative effort that incorporated all phases of clinical trial development and manufacturing in parallel. So for those who know about clinical trials, it can take decades for medications to be approved. They go through phase 1 testing where we find the right dose of a medicine, phase 2 testing when we look at the toxicities of the intervention, and then larger phase 3 studies where we compare the intervention to placebo or the standard of care in a larger number of patients. And generally, again, these phases of drug development take decades. But for COVID, this was a priority, and all of these phases of clinical trial development were done in an overlapping fashion. And the drug company manufacturers also started to make supply of drug just in case there was a positive signal, because we were in such dire need of a vaccine. Our regulatory agencies also prioritized the review of these vaccines. And then we also have to give thanks to the thousands and hundreds of diverse people who volunteered. And if you look at the studies, you want to know if the people who volunteered look like you. And I can say, and hopefully you will trust me that I've reviewed the data, there was equal representation amongst gender, equal representation amongst ethnicity and racial groups. Although the volunteers were primarily healthy, some did have other medical problems. Patients could be obese, could have high blood pressure. Go back 1 second. So really, the clinical trials were hopefully representative of our current population. Next slide. And the effects of the vaccine are still being studied, and the CDC has developed a reporting system whereby patients who get the vaccine and notice a symptom. They're reported and analyzed on a weekly basis, and they are reviewed to see if these safety reports require any different management. This is essentially how we knew to monitor for allergies, because it was reported in this adverse event reporting system. Next slide. So what about the new strains of the virus? And this is why it's really an urgency to get so many people vaccinated, because as the pandemic continues, viruses, they're smart, they want to mutate and persist. And when they mutate, they outsmart our immune system. They maybe become more infectious. They maybe cause more severe disease. And we now know that there are at least 3 variants that are worrisome and causing disease in a different fashion. And the recommendation is still to get the current vaccines that are available, and studies are looking how effective the current vaccines are to these variants. And I suspect over the years to come, we may need booster shots for COVID disease, because these variants will be developing. But it's important to remember vaccination is still our best tool to help protect us. Next slide. So I'm finishing up here. We've been talking about the immune system, and I just wanted to review 2 concepts, which are active immunity and passive immunity. So active immunity is if you were to get COVID and your body was to make antibodies and you recover. And then we reviewed vaccination, which is when you're presented a mug shot and kind of tricked into making antibodies. But there's another type of immunity called passive immunity. And this is when you have antibodies that are made externally to you and transferred to you. And we see this in people who have recovered from COVID, and there's been a call by blood banks to have them donate their convalescent plasma, because they now have plasma or serum that has antibodies that could benefit newly infected people. This is also how mothers pass antibodies to their newborns. And then there are monoclonal antibodies. And this is what I would encourage everyone to look into if you are acutely infected with COVID. Keisha, if you could just hit the next click button, because there are 2 monoclonal antibodies that are now authorized. In order to get them, you need to be within, I think, a week or 10 days of infection and have only mild symptoms, not be admitted to the hospital. And again, this was the treatment that, you know, a select few were able to get and have better outcomes. And there are certainly clinical trials that are looking at using these monoclonal antibodies for people who might be at risk for exposure in nursing homes, maybe giving these antibodies preemptively to help decrease COVID disease. Next slide. So I recognize that there is vaccine hesitancy, and although I'm passionate about getting vaccines because it's impacted me personally, my patients, my colleagues, there's certainly people who are not going to get vaccinated. And at least in this study by the Pew Agency in November, about 50% of people were agreeable to getting vaccines, but there was still about 2 in 10 people who said they were pretty certain they would never get a vaccine. And you can see that this perhaps varies by age, gender, race, political affiliation, education level. And part of the intention of programs like this is for us to hopefully communicate, provide facts about vaccination, be transparent, and hopefully encourage people who are on the fence, and I'm sure there's some in this audience, who just need a little bit more information before they're convinced to proceed with vaccination. Next slide. So that's all I prepared to talk about. I'm certainly willing to take questions, but it's going to take time for us all to be vaccinated. And in the meantime, we have a lot of tools in our kit to prevent getting COVID disease. And even with vaccination, we need to wear masks, wash our hands, and maintain appropriate distance. So with that, I'd like to say thank you. I've just listed some websites because this information is changing literally on a weekly basis. So for the most up-to-date information, I'd encourage you to go to the cdc.gov website. And for available clinical trials in your area, there's a website called riseabovecovid.org, which is helpful. Thank you.
Thank you. Thank you so much, Dr. Phillips. So I have a question. I'm going to interweave my story. So our link is that I am a breast cancer survivor of 1 year and also a medical professional. For me, it was very unnerving about COVID. I stayed home during the height of it. I was kept at home. I did chemotherapy during COVID, unfortunately, even my last session by myself. So one of the questions, and I'm going to pose some questions to you and then also to our county representative, is if a person has low white blood cell count due to being immunocompromised, let's say they're frail diabetic, they're a cancer patient like myself at that time, HIV, what is the recommendations or how does COVID affect those patients versus somebody who's a bit healthier?
So to be honest and fair, was that for me? I'm sorry.
Yeah, go ahead, doctor. You do the clinical portion. I do the health policy and the protocol part.
Yes.
So patients with compromised immune systems on chemotherapy with certain medical problems were not included on the study. Patients with HIV actually were allowed on the study. But the recommendation, it's a case-by-case basis. The concern is not that the vaccines are going to cause any added toxicity. It's that your immune system might not be able to produce an effective response, make enough antibodies, make enough cellular components to fight off the vaccine. So, you talk with your doctor and, for my patients, if I see a break or a window between when they're getting chemotherapy and their white blood cell count is maybe at their highest, I sneak right in and tell them, now's the time to get their vaccine. We have some clinical trials that are looking at checking, blood tests and antibody levels to see if that can predict if, that 95% efficacy that we saw on trials can be transferred to the immune suppressed population. We don't know. But generally, I would say talk with your doctor, and the concern is more that you won't mount a good response, but you still need the protection, so it's recommended.
Thank you. Second question, and then I'm going to turn it over to Ms. Lordo. So a lot of people are concerned about if they're vaccinated. As you can see what's going on in Miami Beach right now, everybody's buck wild. If I have the vaccine, I'm fine, and I can't get it, and I can't transfer it to anyone. So I want you to clarify for us, if you're vaccinated, A, does that mean that you cannot get COVID? And B, if you're vaccinated, does that mean that you can't transfer the vaccine, cannot transfer or give someone COVID?
No. So those kids in Miami are really putting themselves at high risk. So as hopefully you saw in the presentation, vaccines will prevent you from getting severe pneumonia if you contract COVID. It might keep you out of the hospital. But there have been people who are vaccinated that still got COVID infection. They perhaps were asymptomatic and didn't get sick from it, but you can still transmit the virus even after you get vaccinated. So no, you need to still keep washing your hands, wearing masks, maintaining distances, because there's a still concern that you can transmit the virus. And we don't know how these current vaccines work against the variants, right? So, they're newly developing. The vaccines were in testing last year. And just like our annual flu shot, the flu shot from last year is not going to be effective for the flu this year. You're going to need another flu shot. So I think the same is going to happen for COVID vaccines.
Thank you. And last question before I give it to Ms. Lordo. So if you're not vaccinated, because there's always those who have the right and feel like I don't need the vaccine, I'm a healthy person, do those people put the other people more at risk for transmitting COVID? Are they more highly, what's the word I want to use? Would they be more highly infective than a person who has been vaccinated? Because that's been always the conversation that people are having now about family members being around each other, who's vaccinated, who's not. Is the non-vaccinated person more at risk for passing on the disease, or is it an equal playing field for both people?
So that's a tough question. I mean, I think if you're not vaccinated, you're at high risk. I know the CDC has come up with some recommendations where I think, if you have 6 people in a family or household, if they're all vaccinated, they can be together with perhaps less precautions. But then if you're with others who are not in your household, have not been vaccinated, then you're still at risk and you should, continue the recommended precautions. My recommendation, both personally and as a healthcare professional, is that really everyone should be vaccinated. If you're not vaccinated, you're putting not only yourself at risk, but those in your immediate circle at risk, and particularly those who are older and have immune systems that won't fight off the infection well.
Thank you. I want to turn it over to Ms. Lordo. So Ms. Lordo, thank you so much for joining us. Questions. We're in Essex County. I live in West Orange. Woo-hoo. How, first of all, a lot of people are asking where and how do we get these vaccines? So being in Essex County, where would you tell people to go to get a vaccine? Are they going to a pharmacy? Are they going to a hospital? What is Essex County saying?
So good evening, everyone. I'm actually sitting at one of our vaccination sites now from the county. So everyone, I think you actually mentioned it. Everyone has a COVID story. So before I begin and start discussing where to get your vaccine, how to get your vaccine, I want to tell a little bit of the Essex County COVID story. The COVID story for Essex County began on March 26th of 2020. That was our first testing site. We were one of the first in the state to start testing, and we at one point were testing 6 days a week. Currently, we're testing 2 days a week, and that's at one of our Newark locations and also in our Cedar Grove location. And then exactly 9 months later, we were the first in the state to start vaccinating on December 26, 2020. Essex County currently has 5 vaccination sites. Those vaccination sites are located, 2 of them are located in Newark. One is at Essex County College. One is at Donald Payne in Newark. The other 3, one is actually in West Orange at the Kmart that used to be a Kmart on Prospect Avenue. Then there is a site at the Livingston Mall at the old Sears location. And then there's one at the West Caldwell Tech. As we were the first to start vaccinating, one of the major things that I was tasked with was creating protocols for the vaccination sites that were going to be open on December 26th. So what we decided to do is those individuals who are eligible for a vaccine should be going to what used to be our testing site, should now be going to essexcovid.org. At essexcovid.org, you can go ahead and register for your vaccine if you're eligible. As of March 29th, the eligibility has greatly increased, and on April 5th, we will now be vaccinating individuals 55 and over. With protocols for our sites, one of the major things that I had to, since we were the first to start vaccinating, one of the things that I was asked, at first we were not vaccinating pregnant or breastfeeding females or individuals. We then, after the new CDC guidelines came out, a little bit more research was done. We currently are we are vaccinating pregnant and lactating. So a lot of individuals also ask me, what is it like to get vaccinated? I sit at a vaccination site, numerous vaccination sites during the day. So for me, my life is vaccination, and I kind of know exactly what it is. And one of the impediments that we are starting to see is that individuals are just scared to see what it's like, and they're scared to go. So what does a vaccination day look like, and what is it like to get vaccinated at one of the Essex County sites? So the first thing that an individual is going to do, they're going to go to essexcovid.org. That is not actually our phone number. That is a state number. So if we actually do have our own vaccine call center, so I'll put that into the chat as well. No problem. So what you do is you go to the EssexCovid.org website. Please don't mistake it from the NJVSS, which is the one that connects you to the mega sites, which just opened up in Newark. So our sites, go ahead, you register. You must be 18 years old because we are doing the Moderna vaccine. Once you register for your first appointment, you will then be automatically registered for your second appointment 28 days later. Once that appointment is registered, confirmed on our end, because making sure that you're eligible, we then go ahead and send you a text message and an email with a screening number. That screening number confirms your time. It confirms your day. They're kicking me out of my own vaccine site. So I'm going to finish this up and I'll take the rest of it in my car because they're kicking me out.
No problem.
So once you go ahead and get your appointment, you go to one of the vaccine sites. The vaccine locations are actually assigned by area code, and that area code is correlated to the health officer or the person who is responsible for your jurisdiction. So our health officers sometimes are responsible for more than one municipality, so we group them together to ensure that they have proper data for all of their municipalities. So once you arrive at one of our sites, you'll be greeted probably by someone you know from your community, because a lot of the individuals who are at our sites are volunteers from the towns in which are participating at that site. You then will go through pre-screening. Pre-screening will check that you have a screening number. They will screen you that you do have an appointment. Once you've been screened and that your screening number is correlated to that date and to that appointment, you will then move on to registration. At registration, you will be confirmed with your correct address, name, birthday, and all of the information is correct for us to go ahead and input it into the New Jersey Immunization Registry, confirming that you did indeed get your COVID-19 vaccine. At that same registration station, you will receive a card, which is that CDC vaccination card. And then you will move on to inoculation, or where you're going to get your vaccine. You will walk into one of our private pods. The pods will then go ahead and you will get your vaccine. You'll be asked which arm is not your dominant arm, and that is where you will be getting your vaccine most likely. You will move on to our monitoring station. The monitoring station is where you can go ahead and you're going to wait either 15 or 30 minutes. 15 minutes is for any individual who does not have allergies or any other reactions. The 30 minutes, you will be asked to go ahead and wait if you do have reactions or allergies or have had previous reactions to any vaccines. So after the 15 or 30-minute monitoring, which is done by doctors, EMTs, and paramedics at our site, you will be escorted to go ahead and make your way home. And then you will go ahead and come back 28 days later. And then on your second dose, you're done with your vaccine journey for now. So when am I eligible for a vaccine? So the eligibility does change, but one of the things that we do know, if you've received any type of vaccine in the last 14 days, you will not be eligible for a vaccine. If you currently have COVID or have tested positive for COVID in the last 10 days, you will not be eligible. If you have severe anaphylaxis and have at one point used an EpiPen for anything that is an allergic reaction to what is in the vaccine itself. So those things are very important for us to go ahead and acknowledge. The other is if an individual is determined to be a direct contact of someone, we do not screen for that at this time, but we do encourage those individuals to call our call center and to go ahead and change their appointments because they are supposed to be in quarantine. One of the other interesting things that we are doing here at the county, besides our vaccination sites, our 5 vaccination sites, we are moving to senior buildings. We are moving to vaccinate the homebound. We are also moving to vaccinate the vulnerable and transitional and domestic violence home populations. So currently, on top of the 5 vaccination sites that we do have operating, we have a mobile community site. The mobile community site functions at churches, senior homes, and also community organizations. At those sites, we are using the J&J vaccine, which is the 1-dose vaccine. We're also using those at our homeless shelters because that population is very difficult to track. So at least we'll be able to give them an immunity and with one dose. We're also administering those at domestic violence shelters as well. We actually vaccinated 50 Holocaust survivors with the J&J about a month ago, and they were all over the age of about 90. So that was very interesting to see every one of them getting the vaccine. So now that you know how to get our vaccine, one of the things we do get asked, if you, as a senior, that's one of the questions. You may not have access to the internet. No problem. You can go ahead, and I'm going to put that number into the chat. You could call our 35-person call center. That call center is open from 8 a.m. to 8 p.m. Monday through Friday. It is open from 8 a.m. to 4:30 p.m. on Saturdays. The call center will go ahead and register the individual if they don't have internet or are not capable of using it. You will receive your screening number. That screening number, even if you lose it, can be looked up by your last name or by your phone number that you register with. Also, we currently have a pilot program right now at our Newark location at Essex County College. We are going to move it to a different location probably on Monday. That's to be announced, but that is for senior transportation. And that is not to be mistaken for the senior homes. That is for individuals who live in their own home, who need transportation to the vaccination sites. In order for a senior who does need transportation, we encourage them to go ahead, call their local health department. Their local health department will arrange transportation. They will also arrange an appointment for them. So we will go ahead and transport those seniors. We will go ahead and give them an appointment and they can go ahead and get vaccinated. And lastly, the homebound. That's been a very tough population, and with the transportation of this brand new unpreservative vaccine, just making sure that we're going to go ahead and start vaccinating individuals who are homebound. And a lot of people, there was a question that was asked to me, but the homebound are home. I was like, but the homebound, those individuals want to see their grandkids. They want to be able to interact. They miss them. And the grandkids are scared that if they come over, something may happen. Or even it doesn't have to be an elderly person. What if it's a physical disability? They need to be made safe just like everyone else. So what we're doing is we're working with our local health departments, and we're going ahead and allocating our J&J vaccine to them. So any individual who does have a homebound that needs to be vaccinated, please go ahead, contact your local health department. They will arrange for that coordination to work, and public health nurses will go ahead and vaccinate those individuals. They're doing about 10 individuals a day. And I just see in the chat, yes, we are also vaccinating about, at this point, we're a little bit inmates in our corrections facility as well. We did get a large allocation going forward to that, both to the staff and also to the inmates as well. One of the things that for me, I started 4 months before COVID hit as the Essex County Health Officer. I had no chance to see what was going on around me. I really didn't know. But I am more than thankful, and I am grateful to be able to not only be humbled, but also to just take a look and step and to understand one thing. One of the questions that you asked was, if somebody chooses not to get vaccinated, how does it affect everyone else around them? Well, I think getting vaccinated in the end is a choice. And the only thing that we can do as healthcare and health officials is go ahead and give you that scientific advice. But I'm also a yoga teacher. And one of the things that I find is that if you choose not to go ahead and get vaccinated, you have to choose to also practice that social distancing no matter where you are. You have to choose to keep your mask on, and you have to choose to use public health practices and hygiene and everything else that we're trying to preach. In the sense that when we come to someone's home and we know we're not vaccinated, perhaps maybe staying away from them in 6 feet, perhaps wearing your mask. If you choose not to get vaccinated, you also choose to make other decisions. And that's something that I really would like to be able to share with everyone, and to hope that they also understand that. And also, doctor, I hope you agree with me, is that if you do get vaccinated, you actually shed less virus. And the viral load that you're shedding is a lot lower than what you would normally if you were not vaccinated. So what they're finding is that's what they're finding in the current case. The one thing I'm not happy to say is right now here in Essex County, our numbers are going up. They are. They're going up all over the state. They're going up all over the country, but we are definitely on the rise. So with that being kind of my last statement, I think we all need to take one thing. We need to take acceptance for what we choose to do. We need to make sure that whatever choice we do make, but as a health official for the county and also for just myself and my family, I would also go ahead and choose to get vaccinated. We can get ahead of this, but we do need to take responsibility for our own actions, and we need to acknowledge that COVID is not over. We need to acknowledge that we may all be so tired. I'm tired. I have not had a day off probably since March 26th. But I wouldn't be sitting here and having this conversation if I didn't believe in it. And I just want to say thank you so much for being with such a panel of such amazing women and just having to sit here. I really truthfully appreciate it. And I wish that if there's any other questions, I'm going to go put some of the stuff into the chat. But if anyone has any questions for me, please go ahead and ask.
I have one last question for you because I know they're kicking you out.
No, I'm actually, you know what I'm going to do? I'm going to go on my phone because they're kicking me out of school.
No problem. No problem. The question, I'm going to wait to pause for that question and go back to Dr. Phillips then. Dr. Phillips, a lot of people are concerned about if everyone's not vaccinated as of yet, why are some jobs pushing people to go back to work/school so early? What's your comment?
I can only give my personal comment. I'm a medical oncologist. I'm not a public health official, but I can say that when I tested positive for COVID, the requirement for me to come back into work was to be without symptoms for 10 days. And the thinking of that is that if you're without symptoms, you don't need another test because sometimes you can still shed the virus, but it's not infectious. And I've certainly seen people, particularly immunocompromised people, shed the virus for months, but they're not coughing, they're not infectious. And I think I saw a chat question about levels of antibodies. We don't know what levels of antibodies mean, but there is something called the CT value, which is used for investigational purposes only. And it can tell you how infectious a person is. So I don't know if the person who asked this question perhaps had that CT value done, but the higher the CT value, the lower your chances of getting infection, and those people can still come back to work. School, I leave that to the public health officials.
Thank you so much. I don't know if Maya is back on the phone. Maya, are you back with us? I guess not yet. She's in
I can
chat.
take a minute to answer another question I saw about in the chat, just about the vaccines getting into your DNA. That comes up a lot. No, neither of these vaccines can get into your DNA. For the mRNA vaccines, they really only go into, if you recall from biology, the cytoplasm of the cell. They never enter the nucleus, so they can't be incorporated into the host genome. And for the viral vector vaccines, the viruses have been completely inactivated, so they don't have the enzymes to incorporate them into your DNA. So no, these viruses don't get into your genetic system.
So no zombies for all the people who've been given the craziest stories I've heard.
Zombies, microchips, no.
No microchips either. My last question is to Maya. And the question is, a lot of people live in multi-generational homes, from grandma to grandchild. And so one of the questions, as an example, was if you have grandma who's 84 and the youngest grandchild is 16, and I know what you're going to say, but I'm going to pose it anyways to both of you. Is the 16-year-old allowed to go with grandma and get the vaccine too? I know the answer to this, but I'm going to pose that to Maya first for the non-clinical side, and then to Dr. Phillips for the clinical side. So Maya, did you hear that question?
I did. So the 16-year-old is allowed to go. They just need to make sure that the vaccine that they're getting is the Pfizer vaccine.
Correct.
And right, our sites, we are doing the Moderna, which is 18 and over.
Okay. Dr. Phillips, any comments about grandchildren getting vaccinated with their grandparents?
I would agree with the public health official. I don't treat pediatric populations, but certainly I have cancer patients who have young family members that they want to see, they want to hug, and it would behoove everyone in the household to get vaccinated to allow that to happen.
Absolutely. This was a lovely discussion. We never want to abuse anyone's time as we're coming to 8 o'clock. And I wanted to thank Ms. Maya Lordo from Essex County, our health executive extraordinaire, and Dr. Adrian Phillips, extraordinaire. Thank you so much for giving your time tonight. And of course, our guests, we appreciate you tuning in to the Alpha Kappa Alpha Sorority Incorporated, the Omicron Xi Omega chapter. So without further ado, I'm going to turn it back over to Madam President, Emily Nichols Mitchell. If someone can mute their phone, I think that's Ted Stevens. If you can mute your phone, sorry for getting background. Thank you.
And I actually, Doctor, I wanted to actually introduce Ted Stevens. So he's actually, yes, he is the, I'd like to welcome to the call. He's the past Grand Polaris of the Iota Phi Theta fraternity and the Essex County Chief Prosecutor. So I'd like to give him an opportunity to say a few words on the call today.
Absolutely. Thank you.
Good evening. Connie Bentley McGee asked me to get on this evening, and based on hearing Dr. Phillips and of course my good friend Maya Lordo, I'm not sure really how much I can contribute to this conversation. You had the physician, you've got the healthcare professional there, and they both are equally not only knowledgeable but passionate for, I think, dealing with this virus that has overcome pretty much all of our lives. So the only thing I can just add, perhaps as someone who supervises a very large organization, the Essex County Prosecutor's Office has about 480 members of the office. And so we have been involved with trying to just manage it through use of A/B kind of teams and whatnot. So we're just concerned that everyone gets vaccinated or stays safe, and because it will certainly proliferate through organizations. And we've, like so many people on the call, have had individuals in our office who succumb to it, family members have, and it takes a toll. And certainly it takes a toll, at least on everyone's psyche, worried about whether or not they're going to be the next one who falls victim to it. So I am a staunch believer in vaccines. I got mine as soon as it was available. And I've encouraged everyone to do that, because I think through that, what's so-called herd immunity, we need to reach that point, and we don't need to be dissuaded by so many things that are wives' tales in the community for people. Some people are legitimately afraid of needles. Okay, that's something that we have to deal with. Perhaps Johnson & Johnson is the way to go there, where it is just a one shot, even though I did take Moderna and I had my 2 shots. But I'm pleased to say that I had no effects from it, thank God. But also everyone, those who want to be deniers everybody wants to talk about the Tuskegee experiment. And I'm like, listen, you can't even tell me what year the Tuskegee experiment happened. Don't all of a sudden you want to latch on to that as if it's some sort of a reason, and it becomes almost a boogeyman tale as far as I'm concerned. I trust our healthcare professionals, those that are African-American and those who are not. And everyone has convinced me that it's better to get a vaccine than it is to get COVID. And so that's the message I think that we all need to be putting out within our communities. Frankly, I think there's an opportunity for all the Pan Health organizations to really do what we do best, which is interact with folks at a grassroots level in all of our communities. Iota Phi Theta certainly does that. We have been involved in food insecurity drives, and every week for the last year, my chapter and other chapters in North Jersey have partnered with either the County of Essex or with the East Orange Senior Citizen Center in order to deal with that, because that's an offshoot of this vaccine pandemic. So there's so much we can all do, and I'm positive that Alpha Kappa Alpha has done more. This is certainly just one of the many things you've done. So we're all happy to do whatever we can to make sure that individuals get vaccines as soon as possible, and that we try to make life a little better for those until this pandemic is over.
Thank you so much, Mr. Stevens. That was really good information. And thank you for the Brothers Iota. Thank you so much.
Yes.
I'm going to turn it back over to, if there's no additional comments, to Madam President Emily Nichols Mitchell, if she can take over.
Thank you so much. I am super excited. This has been a phenomenal event, and I just want to take a moment to say thank you to Dr. Cordai Decoto for moderating this event, and I want to thank Dr. Adrian Phillips for taking time out to come and be with us, as well as Ms. Maya Lordo for stepping in and giving us all some great information. But I also want to thank the Connections Committee, Rhonda Robinson, and everyone on her committee, which I think is Kimberly Cummins and Keisha Trotman. I just want to thank everyone. And if I left out someone, maybe Connie Bentley McGee, I want to thank you all for putting together such an amazing event and for all the information that you shared. So I have had the first vaccination and I have my second one on April 9th. And I will please, if you're on this call, please share with your friends. This information was such good information. I hope you took notes, and I hope that you will share it with other people in your family so that they can feel more comfortable in going out and getting the vaccination. And I'm going to turn it back over to Rhonda Robinson.
Thank you so much, Ms. President of our chapter. I want to thank everyone for joining today. I know as much time as we spend learning about COVID and the vaccine, I learned a couple of new things today. So what we want you to do with this information is take in the information and share it with others. It's really important that we get the word out because we all do want to go back to some form of normal life. And the faster we can go out and get vaccinated and make sure that we have the right information, the faster we can get back to leading a life that we had prior to March of 2020. So be safe, and we look forward to working with you in the future. Thank you so much for joining us tonight.
Have a great evening, everyone.
Have a good evening.
Good night. Bye-bye.
Good night.
Thank you, everyone.